Hello. I don't, your mic's not on. You can turn it on.
Hello.
How are you?
Good. How are you? Can you hear me okay?
Yes, I can.
Wonderful.
It's nice to have you on.
Thanks for having
We
me.
usually takes a little bit for people to jump in. B is here. She's the one that invited you and asked, sent out a request to ask you. And we put out on our Facebook um the notice that we would have a guest speaker. So people come and they go. It all depends on symptoms and whatnot. So they
Hi,
know to
Chelsea.
Hi, so nice to meet
I love
you.
your shirt. I love it.
Gotta represent.
That's right. I love it. She's like my star. I love her.
Love it. I love it.
How are you? Thank you for doing
Good.
this for us.
Yeah, this is so fun. Thanks for having me. I think I was
Yeah,
supposed to ask one of you to make me host so I could share the
sure.
presentation or co-host or something.
Yes. I always forget how to, hold on. Host tools. Let me go into that. I think it's up here in the docs.
Yeah, I think,
I only see make host, so I'll make you the host because I don't have the co-host part. I don't see that.
yeah,
There you
perfect. I am now the host. I'll let people in as they come in too if I need to let them
Okay,
in.
and just a reminder, I when I have guest speakers, I do live stream to you too.
Okay.
So that it's more awareness, more education for FND.
Wonderful.
So let everybody know that through our group, and some people, private, so they need to have a heads up on that.
Yeah, makes sense.
And if you're on a time schedule, feel free to start whenever you like.
Okay.
People will be just popping in. That is just normal.
Yeah, no problem. No problem at all. Yeah, I
And
think
then we'll
Yeah, just give
I
them
just
and
some
have to.
time. They're coming in. They're coming in slowly.
yeah. And then are you
Yeah.
you have time for a Q&A afterwards as well?
Yeah. I just put together a little presentation about us and what we do. Hello, welcome. And yeah, we'll have time for some question and answers. I'll try my
Awesome.
best to answer as many questions as I can.
That's awesome. All right. I'll let you have the floor.
Perfect. Okay, let me
Remember,
see if I can share my screen
if
here.
everybody can put their mics down though too, until we do in Q&A time, we'll do the raise your hand thing.
Let's see here. Present. Interview. Got it. Okay. Share. Okay. Can you all see my screen? Yes. Good. Thumbs up. I'm seeing thumbs up. Okay, fantastic. Well, welcome everyone. I'm so honored to have been asked to be a guest speaker with you all at FND WAVES. It was really lovely to connect with other individuals in the FND community. So I'm super honored to be here. My name's Chelsea Richardson. I am a neurologic specialist, physical therapist, practicing out of Re+Active Therapy and Wellness in Los Angeles, California. My goal today is to share some information about what we do at our interdisciplinary practice and some approaches that we take when we're working with individuals with FND, but also to share lots of resources. So I've created a little resource sheet that I'll email out to the FND WAVES community, and you all will have access to it. And really just trying to spread awareness like you all have as a mission, to support individuals who have FND. A little bit of background.
It's
Sorry,
nice to
April,
have you on.
something?
Sorry.
You're
It
good.
wasn't it was I got it was back music, back sound. Sorry. I thought I had my mic off.
Yeah, no problem, no problem. So I always like to start with just a little disclaimer. I'm not going to be providing any one-on-one direct medical advice. I can only practice outside of this or inside the state of California with my license, but this is educational and supportive resources. And I will try to answer as many questions as I can to support you all, and also to guide you to who the medical provider that might be the best fit for you would be. So a little bit about me, myself, and Re+Active. So we are a interdisciplinary practice in Los Angeles. We currently have 2 locations in Los Angeles with about 37 team members, and I feel like we're growing every day, but we have physical therapists, occupational therapists, clinical psychologists, and even wellness professionals. So we have a yoga therapist, we have several yoga instructors, and we have personal trainers. And we're really specialized in helping people with complex neurologic and chronic conditions. So this is our jam. And we provide specifically support for people with FND. And I am the director of one of the only physical therapy fellowships in movement disorders. So it's called the Schmidt Movement Disorders Fellowship, which we have here at Re+Active. We partner with UCLA's movement disorder neurologists. And really our goal with that fellowship is to help individuals grow in expertise in helping people with complex movement disorders. So FND and functional movement disorders kind of fall under that umbrella. Most individuals, when they get a diagnosis of FND, somehow make their way to a movement disorder neurologist. So if you've interacted with one of those individuals, we collaborate very closely with those neurologists. And I'm lucky enough to be a part of this practice because we really care about access to care and, trying to make high quality neurologic care a little bit more accessible. And we partner with a nonprofit that's called Resources for Hope to provide some pro bono and scholarship care for individuals who need it. So we have a lot of fun at Re+Active. You can probably see that we do a lot of fun things over here. We're lucky we're actually right by the beach. So I know some of you are all over the world, so you might not be close to a beach, but we're lucky enough that we can even do PT sessions at the beach, which is really fun. And this is like helping someone get back to bike riding. This is a picture of myself and our current movement disorders fellow, Ava, at the FND International Conference that was this last June in Italy. We got to go and present a poster of a case that we worked on and meet so many providers all over the world who are working with individuals with FND. So that's Re+Active and me. We have had quite a journey in helping people with FND. Julie is our CEO of Re+Active, and she started Re+Active, soon after becoming a physical therapist. And back in 2003, she started working with individuals who were given the diagnosis of conversion disorder. And she was like, what is this? So she collaborated with a movement disorder neurologist who's now in Northwestern, Dr. Alan Wu, who was really in the forefront initially at UCLA of talking about functional neurologic disorder and calling it functional neurological disorder rather than conversion disorder, because we know conversion disorder just doesn't describe what's actually going on. And she always says, looking back, she wished she knew more, right? And I even felt that way as I came out of my schooling. But in 2017, we actually launched our first FND intensive program, and now we're a fully integrated team that helps people with FND. And we do about 100 programs a year to help individuals with FND. So we'll talk about that FND isn't as rare as we used to think it was. It's actually much more common. So this is an individual who we started working with in our first FND intensive. And so the video on the left-hand side of your screen is her hyperkinetic movement disorder. And then the video on the right-hand side of your screen is just after 4 weeks of doing an interdisciplinary treatment program. She still has some hyperkinetic trunk movement, like jerky trunk movement, for those who don't know what hyperkinetic means. but much improved. And she identified that she had kind of an 80% movement disorder improvement in the 4-week intensive. So what we loved about this experience was we knew the literature shows that integrated care helps people with FND, but we saw it with our eyes, and we saw there was so much hope possible for people with FND. And I think it really started our advocacy journey to help people find the right resources and support for themselves. So you're all here. You probably know what functional neurological disorder is, but I think it's helpful just to go through it again and talk about how understanding the connection between the brain and the body can actually help with managing symptoms. And if anyone has questions in the chat, feel free to throw them in. Let me make sure I can pull up the chat here. Yeah, I can see it. But I can also answer questions at the end, so we'll have plenty of time. All right, so let's talk about what FND is. And I kind of gave a little teaser that we were going to talk about how common FND is in reality, but it is actually the second most common disorder that is referred to neurology clinics, and that's just behind headaches. So it is actually a very common condition, and probably more common than we know because people don't have access to care right now. But functional neurological disorder is a condition that primarily affects the functioning of brain networks, which is why I love the terminology functional neurological disorder. It actually describes what's going on with the pathophysiology that we've learned through brain studies. That umbrella term, FND, has some different subsets underneath that umbrella. So if you have abnormal brain network functioning that affects the movements of your body, that would be termed functional movement disorder. So that's where somebody has involuntary but learned habitual movement patterns that are due to an abnormal self-directed attention. People can also experience functional seizures. These were previously called psychogenic non-epileptic seizures. In the FND International Conference, they actually had a whole presentation about that they would like to shift the terminology away from psychogenic non-epileptic seizure to functional seizure. So I like the terminology again because it has to do with the functioning of the brain networks. But there can also be functional dizziness, and actually complex regional pain syndrome does fall under the umbrella and pathophysiology of functional neurological disorder. I think some people would argue with that, but it is a pain disorder that has to do with the change in the network of the brain. So it's really a network disorder. What it's not is faking or pretending. And so many people that I meet with FND are told, this is all in your head. You just need to go see a psychiatrist. You just need to go see a psychologist. And that is just so not true. All of us have psychological experiences. We all have emotions. We all have, parts of our psychology that can't be separated from our movements or our, experiences in the world. But it's been absolutely disproven that this is in any way voluntary or that somebody's faking or pretending this. fMRI studies have now shown that there are true network changes in the brain and that this is a very real disorder. Okay, so I want to validate everyone who's here that, we know what this is and we believe you. This is real, and we do know that we can treat it, which is exciting. It is also not purely a psychological disorder. I kind of touched on this already, but it was initially called conversion disorder. And conversion, the term really, suggested that somebody's physical symptoms were a conversion of psychological distress. And that's just an incomplete picture. We all have psychological contributing factors. But if everybody is stressed in the world, not everybody has FND, right? So it's just got to be more complex than purely psychologic disorder. And only about 40 to 60% of people with FND have any history of psychological comorbidities or even trauma, right? So some people don't even have those contributing factors as part of their FND diagnosis, which I think is really important to highlight. And then it's definitely not a diagnosis of exclusion. It really has been treated like that in the past in the medical field. So people usually get all these different series of tests and they're like, well, we can't find anything wrong with you. It's got to be this, right? And that is actually not what we want because there's actually positive clinical signs and features that a neurologist can perform in a clinic to confirm functional neurological disorder and create a positive diagnosis, right? A rule-in diagnosis rather than having a diagnosis of exclusion. So I said a lot there. And I want to just quickly go to the chat. Let's see. April asked, exactly what would one of the diagnoses with, exactly what would one be diagnosed with if they had all the symptoms? Okay, so we're talking about like the FND, all of these, right? Yeah, so probably the given terminology would just be functional neurological disorder because that encompasses all of these symptoms, right? But some people only have things that present in their movement, so they might identify more with the functional movement disorder. But great question. And honestly, the research really does show that most people with FND have a mixed phenotype. So they might start with movements and then maybe they also get seizures or they also experience pain. So very common to have that mixed presentation. Great question, April. So how might this happen? We don't really know, but this is a kind of hypothesis of what we think might be happening here. So based on kind of the evidence that we have and the research that's been conducted in FND, this is kind of the model that has been created that might help us understand why somebody might develop a functional neurological disorder. So there might be like an initial event or an accumulation of predisposing factors. And then, most of us say if we have an injury, for example, we adapt to that injury and we have kind of reconnection as we heal, right? But each one of us are influenced by our life, right? And the environment around us. So there are some positive predisposing neuroplastic factors. So that just means neuroplasticity is the brain's ability to change, and the brain is always changing. And then we all have some negative predisposing factors as well. So things that might influence some maybe non-adaptive changes to our nervous system. And so you can think of an initial event or an accumulation of things combined with some of these maybe negative predisposing factors, and you might have some maladaptive neuroplasticity, which we think is what is happening in FND. Now, there's lots of words on here, so don't worry about all the different words, but these are just some of the experiences that we've seen in fMRI studies. So they've shown that there's impaired self-agency in FND. That's like kind of a key feature. So agency is control over your own body, and that can be lost and impaired in FND. So we get these kind of maladaptive changes within the nervous system. But the good news is that through some therapeutic approaches, we can always make reconnections in the nervous system. Recovery and reconnection is possible, which is really exciting. I love working with individuals with FND because I think there's so much potential for supporting their nervous system and making some really positive changes. All right. So we'll go through some things that we've learned as clinicians, but also at Re+Active that have really been beneficial for taking control of your symptoms with FND. So kind of the three pillars are understanding the brain and the body. There's a lot of literature that shows that the more people know, the better they feel like they can control their symptoms. The second piece is practicing some strategies that help with changing the brain-body connection, some of those functional connectivity challenges, and then finding community and support. You're already doing that with FND WAVES, which is amazing. So we have some community support options too, but I think however you choose to engage with community and support, it can be really powerful as a way to help take control of your symptoms. Okay, so how might we discover what the brain and the body needs? So these are some of the questions that we tend to ask our clients as we're working with them is what systems might be contributing to someone's FND symptoms? So April, you asked the great question of like, what if I have them all, right? Like, how do we know which symptoms are contributing and which systems are underlying those individual symptoms? And then who can we go to help with those symptoms? And then how do we take the next steps? So we love pie charts at Re+Active. We're a big pie chart place. We love pies too. So if you're a pie person, I am there with you. Give me an apple pie, give me a peach pie, give me a cherry pie, give me any kind of pie, and I am your girl. But we really love pie charts at Re+Active because it helps us break down the complexity of FND, right? Into maybe its underlying contributing pieces. So things are always easier to digest when they're in slices. So we have actually developed this kind of pie chart method of understanding functional neurological disorder based on what the literature is showing. So we'll go through these different slices together, but these are some of the things that are coming out in the literature. A lot of people have a motor control slice, a sensory slice, psychosocial, lifestyle, autonomic, and physical. So we'll talk about each of these. But this is really cool because we can actually vary the slice intensity for each person and help them kind of understand which of these things might be contributing to their symptoms the most or might need the most attention in treatment. So these are all the systems that appear to be involved in FND based on the literature. So motor control basically means how we have control over our own movement, right? And I talked about how that can be lost in FND. Sensory is a really interesting part of FND. Most individuals that I meet, they feel dizzy, they have pain, they have loss of sensation, they have heightened sensation, they have areas of numbness that don't make sense, right? So there's a lot of sensory symptoms that suggest that the sensory processing within the brain might be part of their functional neurological disorder. So very, very common. Ooh, someone said Florida key lime pie. I love it. I'm just seeing that in the chat. Yum. Now you can tell that I'm like ready for pie. It is only 3 o'clock here in Los Angeles, but I am ready for pie. So maybe I should have brought snacks for all of us. But yeah, sensory is a very common slice that people with FND experience. Psychosocial, like we talked about, it can be a slice for individuals. There can be some underlying psychosocial contributing factors. And if they're there, it's important to get support for that. If they're small, it's not as big of a slice, right? Contributing to the factors. Lifestyle is a really interesting slice that I think is really fascinating, but really commonly people with FND tend to have impaired sleep. And if we can help with getting their sleep more regulated, that tends to help with their functional neurological disorder symptoms. Fatigue is also one of the #1 symptoms that people with FND experience. So we really need to address how that impacts their day-to-day life and give people strategies for that so that they can manage their fatigue, right? And autonomic is probably my favorite slice. So the autonomic nervous system is our fight or flight. and our rest and digest nervous system. So it controls our homeostasis, so how our body responds day to day to keep us safe and comfortable. And you can imagine that it might be a little dysregulated in FND, right? If you're experiencing abnormal movements or sensations that are painful, loss of sensation, that can be really threatening for the autonomic nervous system. And so we can see some of these autonomic signs and symptoms like rapid heart rate. Someone's really, really hot, and then the next minute they're really, really cold, right? So light sensitivity, even GI tract issues, because the biggest nerve, your vagus nerve of the autonomic nervous system, innervates our gut. So this is why it can feel like, man, my symptoms are so vast and all over the place. It's because these systems, this autonomic nervous system, affects many parts of the body, which is challenging. And then the last is physical limitations. And this is something that I think, most people go to a physical therapist and they'll say, I can't move my foot. And they'll go to a PT and they'll practice moving their foot. And that might be only one slice, right, of their pie. And maybe that gets a little bit better. But if we don't address all these other slices, you may not get the full benefit of recovering. So yeah, and I see, let's see, I see a chat coming in. I'll come back to this at the Q&A because it's a little long, so I want to make sure I read it thoroughly and give you a good answer. But thank you so much for that question. All right, so who can help with these different symptoms, right? So you can actually go into this and create your own pie chart, right? So if I were you and I was looking at, my day-to-day experience and symptoms, I might start to say, oh yeah, I have like a big sensory slice, or yeah, my sleep has been really terrible. So my lifestyle piece is pretty significant. So you might be able to kind of vary your pie and make it your own. Maybe you have a big slice of cherry that is the lifestyle, and then a small slice of psychosocial, right? So once you know kind of some of these slices, it's important to kind of figure out, all right, who can help me with managing these slices? So we at Re+Active, we have physical therapy, occupational therapy, psychology, and wellness. I added speech therapy in here because that's the one other avenue that I think is really valuable and important. We just don't have it as part of Re+Active. So I wanted to make sure I included here as like an additional resource. But speech therapists are fantastic. They can really help with cognitive symptoms and then some of the like speech and swallowing challenges. And I've like had the privilege of collaborating with some really awesome ones around the world. So that could be somebody who could really help you if those are big parts of your pie. Physical therapists tend to really help with the physical, so the motor control, the physical limitations, and the sensory system. Those are kind of our sweet spots. Now, we know a lot about the autonomic nervous system as well. So if that's part of your picture, say you're diagnosed with POTS in addition to your functional neurological disorder, physical therapy can be a great resource for you. If you found like that lifestyle piece was really, really big, the fatigue, the kind of managing your day-to-day life, occupational therapists are great lifestyle specialists. So I think that can be a fantastic resource for some of that lifestyle contributing factor. And then obviously psychotherapy and psychology can be really helpful for emotional understanding if emotions are affecting symptoms, empowerment, self-compassion, and self-agency. So a really, really awesome support network there. And then I love wellness as part of this team as well. Our yoga therapist is phenomenal. I call her our like special sauce, like, In-N-Out burgers, how they have a special sauce that makes the burger so good. She's our special sauce. She's just so fantastic. But I think that yoga is a movement and breath, autonomic regulation, mind-body strategy that can be really powerful for some people. Some people don't like it, so it's really individualized. but I think that wellness side of things can be really therapeutic. Now, not everyone has access to a team, right? Ooh, we do have a Pilates instructor. So yes, we do offer some Pilates as well. One of our physical therapists is a Pilates instructor. I think Pilates is also another really great form of activity. But yeah, not everyone has access to a team. So this has been, I think, one of the hardest parts for me morally and emotionally as I'm meeting people all over the world with FND. And there is a lack of access to, clinicians who are FND literate and who can support you in kind of your FND journey. So we understand that that's not always possible. If somebody does have access to those, fantastic. But if they don't, it can be really challenging. So I like to provide people with resources, and you probably know a lot of these already, but things that I think can be really helpful with finding some support, right? So FNDHope.org, which is pretty popular in the FND community, they do have a provider directory on their website. And when I was at the FND International Conference, they were signing people up for that. The FND Hope was there and that network was growing. So I think over time that is going to grow and grow and grow. So there may be more providers in your area who can help people with FND. Yes, we do. Did any of your staff recover from FND, or did you? Oh, interesting. That's a really interesting question. Did any of your staff recover from FND? I don't know any of my staff's like medical history. That's not part of kind of me interacting with them as a professional, but I don't think so. I don't think any of my like fellow staff members have had FND, but we've seen about 100 people with FND every year who are struggling with FND. So we see a lot of people who see a lot of change and recovery in FND. So we see a lot of possibility, but great question. Oh, patients made full recovery. Yeah. That is also a really good question. So I think full recovery means something different to almost every person I work with FND. Some people, full recovery means getting back to life, even if they still have symptoms. And then some people want complete elimination of symptoms. We're by no means a cure, right? Like we're not claiming that this is going to cure your symptoms. But I have seen people have full resolution of symptoms. Absolutely. I've had people who came in having seizures and then no longer have seizures. So it is totally possible. I try to give people a lot of hope, but not false hope, right? Like that, that things can completely go away forever. But I think it is possible because this is a brain network disorder. So our brains are always capable of changing. So I think there's a lot of hope for recovery. So great questions. Thanks for clarifying, April, with that one. So the other resource I do like is neurosymptoms.org. This was developed by Dr. John Stone, who is big in FND research. And I got to meet him in Italy. I told him he was the Taylor Swift of FND. I think he was very tickled by that. But he is. He's like the celeb of FND, right? And he told this really sweet story of like the very first neurology conference where he presented a poster about FND. They put him in a corner like where the cobwebs were, like where nobody was going because nobody really thought it was important. And now there's a whole FND society about it. And he was just like kind of reflecting on how much things have changed since he started his journey helping people with FND. So if you ever get a chance to meet him, he's the most lovely human ever. But he created this resource website, neurosymptoms.org. And I think it's got a lot of really great resources if you haven't checked it out. It is targeted towards people who have FND, which is really nice. We have a group of practitioners, PT, OTs, psychologists, speech therapists that we work with and collaborate with, and we call ourselves the Brain Bites. And so we actually have a provider directory. So again, these are all going to be emailed to FND WAVES on a little sheet. So you'll have links to all of these things. We actually have a free guide on our website that is some questions that you can ask a physical therapist or a healthcare provider if they're to see if they're the right fit for you. So we do this free guide that's really nice to help you find if that person is going to be a good fit to help you in the future. And then we actually started recently an FND membership and a community, which I'll talk a little bit about, which has been really fun. So, I want to see where we're at on time. We're doing good. So we started this FND membership because we can only treat people in the state of California, and we're able to do physical therapy and occupational therapy internationally on Zoom. So weird that our license is that way. I don't know why. It's like I can't do other states, but I can do internationally. It doesn't make sense to me. But we started this as a way to support people all over the world. So we have weekly online education classes that are similar to this, like education about FND, different aspects of FND, really learning the pie chart, lots of good Q&A, and that can be really helpful. It's live and recorded, so people can watch it whenever they want. We also have specific FND brain body classes and movement classes, and then we have this really cool app where people can support each other in this community. We have like a wins channel, so people share their wins. It's really lovely. So really, it's been really fun to be a part of as a way to help individuals who can't access coming to California to get individual treatment with us. So I just highlighted some wins from people in our memberships. They're talking about glimmers of hope and just lots of potential recovery. Like this person went on a family trip for the first time since having FND. And these are people who are not necessarily getting physical therapy, occupational therapy, anything treatment-wise with us. They're just part of the community. So there's a real possibility for seeing some changes, which is really positive. So yeah, so that's my spiel. Now we can leave time for question and answer. I want to go through the chat and also answer you all's questions, but thank you so much for taking the time to listen and hear some about our practice and what we offer. And yeah, let me go back to the questions. Okay, so we've got Dragonfly Media. Let me read your question here. It's just, if you can help me, great. I've not heard of Irene Diamond. That sounds like a great resource, though. Thank you. And refer peeps with FND. Great. Oh, great. Great. Sorry, so long. Well, it's so nice to meet you. And yeah, I'd love to connect. I'm gonna throw I'll throw my email on the resource sheet that I send out to FND WAVE, so you all have my email, because I'd love to connect and collaborate and refer. And any way I can support people with FND or providers who are helping people with FND, I want to. So yeah. And I love that you're I'm not expecting a cure, but you're wanting to know, could this be helpful? And we also do, as part of our practice, we do free consultations. So if somebody wants to know if coming to Re+Active to work with us is the best fit, we offer a free consultation on Zoom. We can meet you, do one-on-one, really understand your story, and then talk about what our program really is, and see if it would be the best fit. And we're really honest, we're not going to promise something that we don't think is possible. We've done enough of these now that we have some like really clear expectations. And we have like some really great data of what people have gotten out of programs. So we're really able to give realistic outcomes for people. Okay, April, I know you have a question. You raised your hand.
I have millions of questions, and sometimes I think I take on questions that others don't want to say or they're too shy to say.
Yeah,
So if I get those questions for all of you guys, so be it. I'm a chatty Cathy. But
I love it.
I started my physical therapy again, another round of it, more or less because when I developed FND in 2019, prior to that, I'd had 3 car accidents since 1997 up until that point, and a TBI at the cellular level, just under 3 years before the FND. I have had definite visible damage in my neck and in my spine that they can clearly see.
Yeah.
And of course pain is a trigger. So when I'm already tense and it just gets tense up, and then the seizures make it tense up, and then it's just like a vicious cycle. So currently right now, I started last week physical therapy, and I'm asking for the myofascial release because what they were trying to do at first to me was like, I do all this stuff at home. I feel like I'm wasting my time sitting in the car for 45 minutes, driving out to your appointment in the pain. And then, let's not beat around the bush here. Let's get right to business. So I have noticed it seems like my therapist is scared of me because every time they work on my lower back first. It's a woman, then she held me in a room, and then they can make me go out into the big room, which then being loud and all that, I have had to get earphones because of sensory stuff. It's overstimulating. So then I usually end up having seizure. And I went yesterday. So I do Tuesday, Thursday. Yesterday was my 3rd session. He seemed too scared to touch me. And he goes, "Are you ready?" Because I was wanting him to do myofascial in my neck since the lower back was already done. He didn't even spend a minute on me. So I was like, okay, wait a minute, this isn't great. And then he was done. So he sent me off my way. I got to walk out of there without a seizure and without it affecting my triggers and my movement. And I even went to Walmart afterwards, but I held on to the cart because I just thought, oh, I could do this way without having to use my walker.
Yeah.
When more than halfway home, I became paralyzed. Couldn't speak, completely done. And that's to me, that's more frightening than the seizures because no, you cannot even give a thumbs up, because when I'm having a seizure, one part of me is, able to communicate at some point. The paralysis, nothing. Like all I could do is raise my eyebrows and close my eyes. So I had to set up a new system to communicate with my stepmom or my dad for that. But when it comes to how you guys do PT, if someone comes like me that has damage that needs that as well, so you would work on, because I feel like if you're just working on FND movements and you're not going to address some of those trigger points that are really bad and not whatnot, so you would work on that kind of stuff as well.
Oh yeah, yeah. I mean, I'm even like creating your pie chart in my head right now. I'm like, there's some physical stuff here, right? Like you have history of, the car accident. There's probably some neck, the guarding is likely a protective mechanism for your neck.
PTSD, of course, from the head injury, because it was from a student, and it was a pretty violent type of situation that happened. But yes, PTSD was I'm kind of over those kind of symptoms. Like I don't get the nightmares, I don't get all that.
Yeah.
What I do see is definitely I fit into majority or pie.
Yeah.
I felt like
Most
a
people
whole
do. Yeah, yeah,
right.
yeah.
But I would like to be one of those variety pies like you were talking about. Give me a little piece
Yeah,
of apple, give me a piece of key lime. Yeah, maybe
yeah.
even throw a little piece of cheesecake too. I have
Love it.
yeah.
Yeah. Yeah. And honestly, I will say your experience with physical therapy is not unlike most people that I meet with FND. I will say most physical therapists are uh, orthopedic physical therapists. So they specialize in only kind of one area. And
Yeah.
I think this is like the disadvantage of the medical system in general is that we've gotten so siloed that we forget that humans have brains. They have muscles, they have hearts. We can't like separate them out. They're all integrated, right?
Right. Right.
So I honestly feel like potentially seeing a neurologic specific physical therapist might be a better fit for you for a couple reasons. One is I think they could still do the orthopedic things that you need, like, the manual therapy, the myofascial things that are important, but they would also try to integrate that into the other systems with like, the structural changes that you've had within your nervous system and how can we make some recoveries there.
Like the
How are
sensory, because I never had a sensory issue like this, other than migraines. I mean, but like I can't do sounds, like really loud sounds.
And that's very common, very, very common to have sensory sensitivities after TBI and in FND. And TBI is also like a very perfect storm for developing FND because your nervous system is kind of in a metabolic storm trying to make recovery, right, after concussion or TBI. Um, so yeah, all very, very common. So you're right. Like, I think you need some of the sensory tools. And yeah, most gyms are really loud. We're very intentional of like our space. So we have quiet rooms, we have louder rooms, we have, when people need like a cozy corner, we have rooms with cozy corners, and we're able to kind of expose people to sound and then stop, like to help them get back to living because we want you to be able to tolerate sound. But there's definitely times when you need some, sound reduction so that you can feel your
Right.
best.
Right.
So I will say, if you like your physical therapist, we have like a guide on our Instagram. I think we just posted it actually today. Julie might have posted it. It's for clinicians. It's like this FND assessment cheat sheet, and clinicians can download it. And that gets them on our like our listserv so that we send people resources constantly. So if they're open to learning it all about FND, I think that could be a great resource is our Instagram. Our Instagram is just at Reactive PT.
Mhm.
And um, and we just provide lots of resources for clinicians. Now, if you feel like this person doesn't listen to you, I might recommend seeing another therapist because I think that's actually the most important part of therapy is listening to you as the individual who has FND and allowing you to kind of guide what the treatment looks
Right.
like. Because you're right. I think you know your body. There's some things that you feel like you need, and those probably need to be addressed.
Right.
Um,
Okay,
I
that makes
think
sense.
I think you were holding your hand up. Yeah,
Mhm.
dragonfly.
Oh, there we go. Hi, I'm Sarah Trube, the medical massage therapist. Yeah, I've had quite the extensive training. I'm not your general Swedish deep tissue. I follow that high with my patients.
That's amazing.
So we go over it, and then if it's out of my scope, then I refer out. So I'm excited about seeing you. I also met another practitioner here locally that had opened up her business. And so there might be a possibility that I might start working with her. Unfortunately, Medicaid is so restrictive.
Yeah, it really is.
They go by a manual. It's just try to get into healthcare. Alternative healthcare is so hard, especially when you're trying to collect disability, because then you kind of have to hide your money and, you
Yeah.
know,
Yeah.
and it's so toxic. And I've been struggling this week. I had a fall after having an episode. And so I'm fighting for you guys out there. And also, I think you need to find out about other staff members that have recovered, not been cured by FND therapies out there. We don't expect that.
Yeah.
Just the recovery and being able to get back to your career after you've invested almost 20 years, it's it's kind of sad.
Yeah, for sure. Yeah. Yeah, I think healthcare is in a really rough spot. And Julie and I have these like existential discussions all the time about, I think it's really not set up for supporting individuals who really need it. And
I've
yeah,
been told that I'm too complicated by attorneys.
yeah,
Yeah, and that just really affects your mental health. And then you listen to these practitioners that, oh, it's just mental health. Well, you're part of the problem.
right, right. Yeah, 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 yeah.
Um, I will, mute myself here and look forward to working
I'll
with
send
you in the
you.
future. Yeah.
Yeah, that sounds awesome. And yeah, April, you asked a question, do people travel from out of state? They do. We have somebody from New York right now. We've had people from all over the country. Now, my goal in life, and Julian's goal too, right, is that we would build practitioners everywhere so that people don't have to come to California. It's not a terrible place to go, I will say. We're close to the beach, but it's just not possible for everybody, right? And it's just it's impossible to expect that for everyone. So yeah, I mean, we're honored that people are able to come out, and we support people all over, but we're working really hard to build networks of people who can help individuals with FND. We're teaching a course for Johns Hopkins in the end of September. So they asked us to do like an FND weekend course there. I'm teaching an FND weekend course at UC Davis in October. So we're starting, and I think it's gonna grow. But I wish it was faster, and I wish it was something you can access like immediately. But yeah, and we just have so many resources. So if you're ever, wondering like, hey, do you have a resource for this? Or, I met with a provider and they don't really know about FND. Do you have some resources for them? We do. So feel free to always just like reach out to us via like Instagram or on our website, and we're happy to just connect you. We have lots and lots of free resources for people. Oh, cool, Lisa, you're on the wait list for Hopkins. That's great. I'll tell Julie. I think we were able to get some more space, so hopefully we can have more people at the Hopkins one, which is great. And yeah, thank you. Thank you for that. I'm really honored to be a part of people's stories in their experience with FND, and I learn more, I think, from people with FND every day than I ever expected I would. You all teach me so much, and yeah, I'm very honored to be a part of people's stories. So
Thank you.
yeah, thanks for having me today. This was really
No,
lovely.
it's awesome. a little bit of background of our group. I don't know if B was able to tell you, but I've been a volunteer for FND Hope for years and thoroughly appreciate what they do. And they're grounded. Their group is mostly grounded in resources and research and whatnot. And I found that I think there was tad bits of pieces missing that people needed.
Yeah.
So that's where I came in to start my group. And we kind of have a free, you're able to freely speak, on there. What I do is I have set daily posts every Sunday, Monday, Tuesday. They're all the same, usually trying to make a positive mindset. And my background is actually, I was a master's in special education. And I worked with kiddos with emotional behavior disorders. And I also worked with a behavior analyst as a secondary job. So, that I'm not a clinician per se, but I had to be trained by, NAMI and a host of people on how to handle crises and de-escalations and things and through my own personal journey. So what we've been doing, is massive support in our group with each other. And that's when we created the Zoom support chats together. That's been a wonderful help with lots of us. I remember the first time I spoke with somebody with FND, it was so, there's not even a word that you can explain the feeling I felt when I finally got in connection with somebody that had it. And I also do live readings with some therapeutic books. Like doctors have told me, hey, try this book. So I'll use that book and I'll read with our group. And I've done The Power of Now with Eckhart Tolle. Been reading that, and we're going to try to do book clubs. And then she's not on here right now, but one of our other admins suggested doing a therapeutic activities through Zoom. Somebody teaches on Zoom to do something. And I said, well, great, then you can be the first one. But we had a host of things so far, and she taught us how to make doggy and kitty treats. Somebody's taught sewing. Someone taught us Zentangles. B teaches art when we don't have anybody else. So, it's all about connection.
Yeah.
When we can get together. So that's the support I've been able to provide. I am aiming to try to make this a full-on nonprofit organization to also be able to include things like medical equipment, offer that to people that are struggling obtaining medical equipment. And even possibly this is a dream of mine. I hope that it can get that way, is to offer applications for financial assistance between job and disemployment. My speech gonna go, but you know what I mean.
Yeah.
So
Yeah, absolutely.
That's the goal of it, and we're working on that. And the WAVES stands for Warriors, Advocates, Victims, Enigmas, Supporters, and Survivors for the S. So that's because those are the phases our body goes in waves with our symptoms. And emotionally we go in these waves of how we feel having this, how it's interfered our lives. So that's where that came up. A group of us came up with the name of that. So, and B, she created our logo. Thanks, B.
Amazing. You have such an amazing crew here. Thank you so much for having me. I feel really honored. And I look forward to being ongoing. We do some pro bono work. I'll put my email on that resource list, and I can send out. We do have a scholarship application form that's through that nonprofit that we partner with, and we can offer people some scholarships for resources. So I'll send you a bunch of resources. I've got to run, but it was so nice to meet you all. Thank you for having me.
Before you run, could you just switch back, make sure I'm host again?
Yes.
Thank you.
Let's see. That would be bad. Let's see. Here we go.
Thank you so much for coming. We really appreciate it.
Absolutely. Okay. Are you back host now? I think you are.
I think so.
Okay.
Thank you, Chelsea.
All right.
Yes,
so nice
thank
to
you
meet
so
you
much.
all. Take care. Have a great rest of your day.
Thank you. You too. Bye-bye. She was great.
Yeah.
Very validating.
Yeah. It's really good.
I love it.
And
Yeah.
I'm gonna come see you, Dragonfly. What's your name again?
Sarah.
Sarah, thank you. Sorry, brain
You're fine.
issue right now. Yeah, brain fart. I like to call them brain farts. Oh, so are you able to work at all, Sarah?
I'm slowly getting there. I have 2 job interviews coming up in the next week. So I got kind of my birthday wish. My birthday is on Friday.
Good.
So,
Happy birthday.
Oh,
yeah,
happy birthday. That's awesome. So happy for you.
yeah. It's been quite the journey this year, as we all know. So,
Right.
let's move forward.
Yeah. Agree. I see Lisa, Gemma, and Tanya and Bex. Hi guys. I have not get to officially say hi, so welcome.
Hi. Thank
What
you.
guys, what was your opinions of
Hello.
our
Yeah, really good.
guest? Great, wasn't she?
Yeah.
I loved that she was so validating. I want to take all of her literature with me to my appointment.
Yeah. I'll try and get it. Try and get her to email it to me, and I'll post it out on the website.
Thank you.
Yeah.
Thank you.
So
Yeah.
was that all recorded?
Yes, ma'am.
Okay.
I will finish it. And I'll put the link because it's on YouTube Live. So I'll put the YouTube link in the group so you can have it there. Okay.
Okay.
Yes,
Thank you.
for sure. Sometimes my Zoom cloud gets too full, and then it's just easier if I live stream to YouTube. Then I don't have to worry about if I've not remembered to clean up the Zoom cloud from past videos. So it's
Yeah.
automatically saved in the YouTube.
Mm.
I'm in a ton of pain, so I hate to say goodbye to you guys, but I have physical
You
therapy
know
in
how
the morning and
Understand, girl.
a doctor's appointment
All
as
right.
well.
Get
So I
some
can't,
rest.
yeah.
some
And
rest after you feel better.
thank you, B, for all you do for that. Thank you. Appreciate it. And you guys, you take care as well. I think I heard Bex make sound this time. Good job.
Your speech come back.
And yes.
I literally fell in a shower on Tuesday.
Yeah. Listen,
Bruised
her voice.
all my ribs.
Oh.
Wow.
Well, I don't want to keep you all because I know that if I stay too long, I'll be triggered, and I don't want to trigger you all. So I'm gonna.
I'll understand.
Okay.
Right. Is YouTube going to be off now, or we just...
No, because I will just leave meeting. Wait, do you want me to?
Yeah.
Want me to YouTube off?